Thank you, Governor. Good afternoon, everyone. To jump right into our data, we have 321 new cases to report today. Of our COVID-19 patients, 269 people are currently hospitalized. Of these 269, 80 are currently in intensive care units, and 55 people are on ventilators. Unfortunately, we also have 12 new COVID-19 associated fatalities to report. These people range in age. One person was in their 50s, one person was in their 60s, 3 people were in their 70s, 4 people were in their 80s, and 3 people were in their 90s. Our deepest sympathies are with the families of these beloved Rhode Islanders. That's important. Last week, we shared some data on race and ethnicity when it comes to COVID-19 cases in Rhode Island. More specifically, we shared that 44% of Rhode Island's COVID-19 cases are among Latino Rhode Islanders. Though we know we have more work to do, these data, obviously, as we have shared, prompt us to continue to more closely evaluate the data and dig into the details so that we can continue to understand. In public health, we use rates to help us understand the burden of disease or the impact of disease when we have populations of different sizes that we are comparing. We know in Rhode Island that the Latino and African American communities are smaller than the Caucasian population. What we do with the rate is use that to adjust our numbers so we can do more accurate comparisons between populations that are of different sizes. Consistent with what we found last week when we shared the raw numbers, we saw with rates that the Latino community still seems to be the most significantly impacted community in terms of cases. There are roughly 1,129 cases for every 100,000 Latino Rhode Islanders. When looking at the rates, we also found that the African American community in Rhode Island is very significantly impacted as well. Within our African American communities, we saw that there have been 911 cases for every 100,000 African American Rhode Islanders. These two numbers, the 1,129 for Latinos and 911 for African Americans, compare to 220 cases for every 100,000 Caucasian Rhode Islanders. We also looked at the rate of hospitalizations and deaths. What I just shared was the rate of COVID-19 cases. For hospitalizations, a higher rate of African Americans and Latinos with COVID-19 were hospitalized when compared to Caucasian people in Rhode Island. When it comes to deaths, we see that the rates are more or less consistent across all races. It's important to note that we have this data now posted online on our Rhode Island Department of Health website, and we've also put a map online that lets people see the rates in cities and towns throughout the state. We fully expect the most densely populated communities in Rhode Island to have the most cases. But rates allow us to do comparisons by adjusting the numbers for the size of each community. I really want to thank the whole data team at the Rhode Island Department of Health for working extremely hard to turn these numbers around as quickly as they have. They are led by a very talented woman named Leanne Lasher at RIDO, and they are doing incredible things. Rhode Island is a national leader when it comes to COVID-19 data. According to COVIDtracking.com, which is a national data initiative, Rhode Island is one of just a few states to receive a data quality grade of A+. Kudos to the entire team, including all the people throughout state government as well, in addition to the team at the Rhode Island Department of Health. It is a tremendous amount of work that goes into the data that is presented to you each day, and it's really important to acknowledge them. Rhode Island is one of the few states that puts out the level and detail of accurate data in such a timely way every single day. The governor and I talk regularly about working to ensure that all people in every community have an equal opportunity to be healthy and to live in a healthy community. We recognize that having data to inform our work in this area is critical. We need to know where health disparities exist so we can have the testing and support services in the communities where they are needed most, being able to do the contact tracing and support people in quarantining and isolating as they need to. For people who have heard me speak publicly before our COVID-19 response, you know that I've often said that your health should not depend on your zip code, nor on your race, ethnicity, sexual orientation, gender identity, level of education, or level of income. In that regard, our commitment is as strong as ever through this COVID-19 response. And as we start looking forward to getting the economy open again and supporting people in communities that have been most significantly impacted by this crisis, we will need to be mindful of the kinds of disparities that resulted in certain communities being more vulnerable to begin with. Looking at the living conditions, the social, economic, and environmental factors that differ by zip code at this point. We want to use this opportunity to help advance that. Let's improve that and support a bouncing forward to a better state when we're finished with this, as opposed to just bouncing back. This is something that we're going to continue to be focused on across state government, along with our private sector partners. And as I've said, it's something we're going to be engaging communities on as well. Health equity zone members, community leaders, other community-based organizations. I want to thank all of you in advance for that partnership, which we know is going to be necessary for us to get through this together.